Steroids promise muscle and strength, but the reality is far more dangerous and misunderstood. Some compounds like Hallotestin and SuperDrol have sent healthy athletes to emergency rooms, and others hide decades-old secrets from state-run doping scandals. Why do people risk everything for these drugs, and what is each one really doing inside the body? The complete facts start right now. Hallotestin, known chemically as fluoxymesterone, stands out as one of the most aggressive oral steroids ever created. Its structure includes a fluorine atom at position 9, which gives it an unusually high affinity for androgen receptors in the brain and in muscle tissue. This direct action can trigger dramatic shifts in mood and behavior, and users often report a surge in drive, focus, and even hostility. Powerlifters and strength athletes seek out Hallotestin for its reputation as a psychological amplifier, not just a muscle builder. While this edge can fuel intense training sessions or competition aggression, it comes with a cost. The same neurological jolt that sharpens performance can also push mood swings and impulsivity far beyond normal limits. Hallotestin's behavioral punch is why it is both coveted and feared in strength sports. SuperDrol, also known as Masteron, is an oral steroid that gained notoriety as an over-the-counter supplement before its ban in 2012. Unlike most anabolic steroids, SuperDrol was never approved for medical use. Its chemical structure includes 17-alpha-alkylation, which allows the compound to pass through the liver unchanged. That property can deliver rapid muscle and strength gains, sometimes within days. But that same modification makes SuperDrol especially toxic. Emergency rooms began seeing cases of jaundice and acute liver failure, even after short cycles. Hospitalizations and permanent liver injury have been reported in otherwise healthy adults. SuperDrol's appeal is explosive results, but the risk is severe. Many users trade immediate size for lasting damage to organ health. Turinabol, also known as chloroDihydromethyltestosterone, stands apart for both its chemical design and its shadowed past. Developed in East Germany during the 1960s, its 4-chloro structure allowed athletes to build lean, dry muscle without the water retention seen with other steroids. What set Turinabol apart was not just its moderate anabolic effect, but its role at the center of a massive state-run doping program. Thousands of East German athletes, many of them teenagers, were given Turinabol as part of a secret campaign to dominate Olympic sports. Decades later, court records and declassified files revealed forced dosing, lifelong health problems, and a legacy of medals tainted by deception. Today, Turinabol is known not only for its cosmetic appeal, but for the ethics and reputational risks that linger long after its use. Sustanon is an injectable blend designed to deliver testosterone in a controlled, sustained manner. It combines 4 different esters: propionate, phenylpropionate, isocaproate, and decanoate, each breaking down at its own pace after injection. This staggered release keeps testosterone levels more stable in the bloodstream, reducing the peaks and crashes seen with single ester products. For many, that means fewer injections and a smoother experience during bulking cycles. But this steady supply also increases the amount of testosterone available for conversion into estrogen. As a result, users often face a higher risk of side effects like gynecomastia and water retention, especially without careful management. Aquapoise, known scientifically as boldenone undecylonate, began as a veterinary drug for horses, prized for building red blood cell count and stamina. In human use, this injectable steroid is sought for its reputation as an endurance enhancer, and athletes report increased vascularity and steady, lean muscle gain over long cycles. The undecylonate ester gives it a slow release, keeping blood levels stable for weeks. The same boost in red blood cells that helps performance also thickens the blood, raising the risk of high blood pressure, blood clots, and even stroke. This circulation risk makes regular monitoring essential for anyone using boldenone because the balance between performance and health can shift quickly and without warning. Primobolan, methanolone, and enthate is often called the mildest of all anabolic steroids. Its appeal lies in muscle preservation during calorie deficits, especially for those aiming to keep strength and size while cutting. With low androgenic activity and almost no estrogenic side effects, Primobolan is sometimes seen as a safer choice, including among women. that reputation has hidden costs. The compound's subtle effects mean some users are tempted to extend cycles or combine it with harsher drugs, increasing the risk of greater suppression of natural hormone production. High demand and limited pharmaceutical supply have also made Primobolan one of the most counterfeited steroids on the black market. Many vials sold as Primobolan contain cheaper steroids or only plain oil, leaving users exposed to unknown risks and unpredictable results. Proviron, also called Masteron, is an oral steroid derived from dihydrotestosterone. Unlike most anabolic steroids, Proviron doesn't drive muscle growth directly. Its main action is to bind to sex hormone binding globulin, known as SHBG. By doing this, it frees up more testosterone in the bloodstream, making other steroids work more efficiently. Many users turn to Proviron for its ability to sharpen muscle definition and support libido, especially during cutting phases. But its androgenic nature comes with a trade-off: an increased risk of prostate enlargement and related urinary symptoms. For those seeking muscle hardness without estrogenic side effects, Proviron is often used as a supportive agent rather than a primary muscle builder. Masteron, or drostanolone propionate, is an injectable steroid prized for its ability to deliver a dry, dense look before competitions. Its chemical structure prevents conversion to estrogen, so muscle definition increases without water retention. This anti-estrogenic effect comes with a cost. Masteron's strong link to dihydrotestosterone can accelerate scalp hair loss in people who are genetically prone. The same compound that sculpts muscle hardness can also thin hair, making Masteron a final choice for those seeking maximum refinement, but with no guarantees of safety. Every year, thousands of people face health crises from steroid misuse. Most never plan to. Informed choices matter more than ever. The science is clear: your body, your risk, your responsibility.